Welcome to tonight's virtual event, Grief, Grace, and Resiliency, Meeting the Needs of Older Adults in a Time of COVID, hosted by the Greenberg Center for Learning and Tolerance. I'm Will Stoller-Lee, the program chair for the Greenberg Center and the MC for this event. Regardless of our other differences, I think we can all acknowledge one shared experience. We will never forget the past 15 months. Where were you on February 29th, 2020? That was the date when the first COVID death was reported at a nursing care facility in Kirkland, Washington. We would eventually find out that there were other COVID cases in the US prior to that one, but that death alerted us to the massive changes that were about to take place in our country. Even more so for one particular segment of the population, older adults, especially those who were living in assisted care facilities and other congregate care settings. As we reemerge from the COVID restrictions, this is a watershed time for the older adults in our society. People over the age of 60, and especially those over 80, represent some of the fastest growing segments of our population. They have faced some difficult challenges during the pandemic. Higher disease risk, death rates, prolonged isolation and separation from family and friends, lack of access to technology, and distinctive experiences of grief and loss. Older adults are also a resilient segment of our population. They have overcome numerous obstacles during their lifetime and have found ways to face the stereotypes and mental health challenges posed by COVID. They offer instructive lessons for our path forward. Thank you for joining us for this event. Our knowledgeable panel participants will be presenting an inspiring session of compassion and hope, providing universal lessons for all ages. Insight into the unique roles of caregivers over the past year, and practical opportunities to explore new forms of connection and community. A few housekeeping details concerning the structure of this event. You'll have an opportunity to engage with our panelists. In a couple of minutes, I'll step off the stage and hand over the screen to our panelists. There are about 100 of you joining us virtually on our Zoom link. The panelists will open with some prepared comments, and then in about 30 to 45 minutes, we will open up for some questions. Our virtual audience can participate by entering their questions in the Q&A feature at the bottom of the screen. We'll try to answer as many of your questions as possible. For those of you who are in our virtual audience, you have the ability to adjust your screen. For portions of the presentation, you'll see both the speaker and a PowerPoint slide. You have the option to adjust the size of those two portions on your screen. So please take advantage of that. At the conclusion of this event, a recorded version will be hosted on the Greenberg Center website so that you can come back, watch it on demand, and also invite friends and colleagues to view it as well. Now let's get started with our program. When our Greenberg Center team started thinking about this event, we reached out to a friend, Dr. Betsy Bates-Freed. I attended a virtual event she hosted several months ago for healthcare providers in California, and I reached out to ask her if we could create a version of that program for the broader Colorado Springs community. Betsy, we are tremendously grateful for your experience and wisdom. You were instrumental in the vision and design of this program. Dr. Betsy Bates-Freed is a licensed clinical psychologist who practices in Santa Barbara, California, focusing on patients with medical illnesses. A Colorado Springs native, though, she attended Wasson High School and then Denison University in Granville, Ohio, before returning to the Springs to work at both the Gazette-Telegraph and the Colorado Springs Sun. For those of you who've been around Colorado Springs for a while, you know she must be a true bridge builder. She later specialized in medical journalism, writing for Physicians for International Medical News Group for about 15 years before returning to graduate school to bridge the mind-body connection through her doctoral coursework and an internship at a family practice residency program. Betsy and her husband, David, a novelist and journalism professor, live today outside of Santa Barbara with their 2 Australian shepherds. So Betsy, I'm going to hand over the microphone to you. Thank you for being with us tonight.
Thank you so much for having me. And I want to thank you for having this opportunity to talk about a subject that's very dear to my heart and reflects my psychological practice, which is mostly made up of older adults. So thank you. And so if we could have the first slide, please. So tonight we're going to talk about grief, grace, and resiliency. All of these are elements about how the needs have been expressed and at times met of the older adults in all of our communities during a time of COVID-19. Next slide, please. So first of all, I want to sort of define who we're talking about here. Who are older adults? Well, it's a rapidly growing population. This is the population, it's often defined as adults 65 years and older. And in that capacity, there were about 38 million people in this group in 2008, which is not very long ago. That had climbed to 52 million by 2018, and is expected, if you can imagine, to be 95 million people in the US population by 2060. That's pretty remarkable. So what do they look like? There are more women than men. About a quarter of them are racial or ethnic minorities. A sobering statistic, 1 in 10 live below the poverty line. And if you consider that they're either 65 or older, they don't have a lot of earning capacity. So we're looking at a population that doesn't really have an opportunity to change the fact that they're already below the poverty line. And when you look at those numbers, that's rather startling. And the fastest growing population of the entire group are those 85 and older. Next slide, please. So this is a kind of an alarming statistic. By 2034, for the first time in history, older adults are expected to outnumber children in the United States. Think about that for a minute. That's pretty remarkable. Next slide, please. So this is another way of illustrating it. This is from the Census Bureau. And if you look at 1960 on the left, that's about the time when I was born. So, and probably many of you in the audience around that time. So you can see what the population looked like. And if you look over to the right, this is how that has changed. So you can see the entire population has grown considerably during this lifetime, but the parts that are really, really growing are the parts at the very top of the chart. 85 plus by 2060 is actually outnumbering some of the other categories. And you see, as I spoke of before, there are more females than males. And so when I look at this chart, I think about 1960. I was a child in Colorado Springs. I remember a few years later, I would be out on the block on MacArthur Street playing with the dozens of kids in our neighborhood, playing kick the can while we cut off traffic to the street. And my grandmother lived with us, and a few other grandmothers and some grandfathers lived on the block, but there weren't very many. And to stop and think about a block in Colorado Springs having more people over the age of 65 and quite a few more over the age of 85 than the children in the neighborhood, you start to get a shape for what this is looking like. So planners and the medical community, transportation experts, social scientists, social service agencies, and psychologists like myself have known for a long time that we were basically facing a tsunami of older adults, many of whose needs were already unmet. New slide. And then into that picture came a major threat to older adults. The COVID virus appeared and happened to particularly victimize and affect that population. Next slide. So perhaps many of you on New Year's Eve in 2019 were looking at the fireworks that the Ataman Club had set on the top of Pikes Peak. And at that same date, the Chinese government actually confirmed dozens of cases of a strange and virulent pneumonia. Just about less than a month later was the first known death in the US in Washington State. Will mentioned this. The virus was probably circulating in Colorado at that time, but there were no tests to determine that. Less than a month after that, the World Health Organization actually recognized this as the pandemic that it was and named the new virus coronavirus disease 2019, shortened to be COVID-19. New slide. So, cards in hand. Between February 29th and March 1st, many of you will remember that there was a bridge tournament, just a simple event that people were happily gathering and playing bridge, you know, newcomers to the game, as well as people who were very experienced at different tables, shuffling the cards, passing them. And an 83-year-old Colorado Springs woman began to experience symptoms of what would turn out to be this new disease. More players became ill, and tragically, some of them died. That bridge player was Colorado's first COVID-19 fatality. And being an 83-year-old woman who was simply socializing with her friends was emblematic of the pandemic's disproportionate toll on older adults. New slide. So nationally, 8 in 10 deaths, 80% of deaths from COVID-19 have been in adults 60 and older. El Paso County has basically followed that same trend. Adults 70 and over make up just 9% of the population right now, although as we saw before, they will be making up more and more of the population, but just 9% of the population, but 75% of the deaths from COVID-19 in this county were in adults 70 and over. New slide. So this is a chart that kind of gives you some perspective on this. It is showing you that compared to a reference group of children, the disproportionate number of cases, but also hospitalizations and deaths has been staggeringly higher the older a person gets, so that it's 440 times greater chance of dying if you were 50 to 64 years old when you acquired COVID-19 than you were if you were a child. And then it keeps going up to that really remarkable statistic on the right, that a person who is in the oldest old category, 8,700 times more likely to die if they got COVID, and much disproportionately greater chance of being hospitalized and to getting the disease itself, twice as likely. New slide. So what do we know about COVID-19 among older adults? Well, there was higher exposure to the disease because many of these adults live in residential settings. They have people coming in and out, and when you looked at those statistics, they were more likely to get ill. And then the fact is with this disease, a person can have it for many days without any known symptoms. So during those days, in a nursing home or in an assisted living facility, the disease was making its way silent from room to room, from staff member to patient. They later faced isolation in that same lockdown in such facilities. Many of them lived by themselves in a room without any face-to-face personal contact with anyone else. Their food was delivered to their door, and they literally lived as if they were in prison, that they were in isolation in a prison cell. They had more comorbidities, which are accompanying diseases that might make them susceptible to COVID-19, like COPD, which is lung disease, cancer, diabetes, heart disease. We know that all of these illnesses make them more likely to acquire COVID and more likely to get very ill when they do. Also, older people have different immune systems. They don't have quite the same immune response as younger adults. So once they were exposed to this silent virus, it was likely to enter their bodies and make them very ill. So that led to more severe and long-lasting complications, higher rates of hospitalization, and then they are with more difficulties with technology. You have to remember that as each of us tried to figure out Zoom tonight to try to figure out how to find that Q&A little logo so that you can ask your question, you're realizing that some of these people had never used computers or they were unfamiliar with them. Things like Zoom became difficult for people who are hard of hearing. Masks made things very difficult for older adults to speak and to understand what other people were saying. They tend to lip read, even though they don't realize they do if they have hearing loss. So this was a very challenging illness, whether a person was living independently, had moved in with adult children, was living alone in a home, or living in a facility. They have less ability to socially distance. If you think about it, if they're no longer driving, then they need someone to drive them, and that's in a car. You know, before they knew there were masks, they were getting exposed. Before we knew that masks could be protective. Some of them relied on public transportation, and that was not as safe as it once was. And then they had multiplied losses and magnified grief. When we looked at those numbers in the complicated chart on the last slide, you have to remember for every one of those numbers, that was someone's best friend, or that was someone's spouse that they had been married to for 50 years, or that was the person who lived next door to them in an assisted living facility, or maybe they played bridge with that person and that person is no longer there. People of an older age experience more losses anyway. They lose their peer group as they age, and COVID just drastically magnified that. These are people who have gone through very complicated grief during this last year. New slide. So how did society react? Well, there have been positive and negative responses. The positive ones, there was protective social distancing. People gave respect to that. They tended to help people figure out how they could be safe in their home or in their room. There were special store hours for older adults. Deliveries of food and medication, which were kind of a rarity before it became a commonplace thing, so that people didn't have to venture out so much for necessities. Then there was creative outreach. People figured out how to make telemedicine more accessible. They figured out how to provide special phones with increased capacity for acoustics to people who had only a phone to link them with the outside world. And finally, there were positive intergenerational interactions. Many teenagers took this on as a challenge and made it a special project to reach out to the older adults in their communities or in their families. This is just a sign that someone put on a tree near where elders would walk, saying, "Dear friend, you are not alone. Keep your spirits high." Then, sadly, there were negative responses in society. There was a lot of isolation. There was a lot of loneliness, which we're going to talk about in just a few minutes. There was unequal access, terribly unequal access to outreach and protection. Half in this one survey in 2017, not so many years ago, half of people 65 and over in the United States lacked broadband access and smartphones. Finally, there were negative stereotypes of elderly people as being frail or vulnerable, weak, a drain on society. And then there was overt, really shocking ageism, bias, and blame that stunned me. And I would imagine that you heard some of it too. Ideas about rationing care. There were things like hashtag a boomer remover, just, leave these people behind. The defiance and anger with which mask mandates and social distancing were met was really taken very personally by a lot of older adults, as if they had become throwaway parts of our society, that people were really not willing to take simple steps to protect them. And finally, there was a huge economic impact that also impacted this population. New slide. In one study, almost a quarter of older adults reported anxiety or depression amid the coronavirus pandemic. Some groups reported higher rates. If people were overall 65 and older, about a quarter of them had anxiety or depression. If they lived alone, that went up a little bit, 27%. Women were a little bit more susceptible. If they were Hispanic, this was a risk group. Those with incomes under $25,000 had a higher rate. And finally, those in fair or poor health, think about it, the most vulnerable to this disease, the most at risk, were almost half of them had anxiety or depression, which is not surprising. Okay, new slide. So loneliness all by itself, even when you unpair it from anxiety and depression, has a great impact on human health. We know that it is associated with higher rates of overall deaths. A lonely person is so much more likely to die of any cause that it's on par with a person who's a smoker or obese. So that's a very high risk. Loneliness all by itself is a risk factor for coronary artery disease, stroke. People who have heart attacks who are lonely are more likely to be readmitted to the hospital or to die eventually of heart disease. They are obviously more likely to have depression or anxiety, have higher suicide rates, and more likely to have dementia or cognitive decline. New slide. And yet other research points to some better adjustment in this group. Compared to younger adults, 18 to 20-year-olds, who we thought really were going to do pretty well, it turns out, surprisingly to many researchers, that they did far worse than their grandparents. Much higher rates of anxiety in that younger group, depression, trauma like stress-related disorders, post-traumatic stress, and of course, the older adults had less suicidality and less substance use during the pandemic. New slide. So these are intriguing findings that point to a level of self-protection and resilience that we never thought was actually as powerful as it is in our oldest of citizens. They have a variety of vulnerabilities and coping styles, obviously. But in some people, what the research is finding is that isolation, what we thought of as like a terrible thing, and loneliness, actually made them have lower anxiety. If they were alone, they felt more safe from the virus. We found out they don't need many relationships to feel protected and feel comforted and connected. Just a few meaningful relationships made a difference. Technology helped. Many older adults actually for the first time sought psychological help. And we found that wisdom is a protective factor and has been through the pandemic. It's inversely correlated. In other words, it balances out loneliness. And what is wisdom? Self-reflection, perspective taking, drawing on a lifetime of experiences, accepting uncertainty, guiding others, and spirituality. New slide. So I've seen this in my own patient population. I've seen people who use this opportunity to write their memoirs or to teach their caregivers how to cook, or to decide to connect with other people, to take that brave leap and play bridge on Zoom, things like that. And so we're going to turn this over to some other experts that are going to tell you specifically how the COVID epidemic did evolve in this population and how you can help. So I think that I am going to turn this over back to Will. Thank you.
Thanks, Betsy. That was really helpful to have that overview of the situation. For the audience, I just want to remind you that you can put some questions in the Q&A icon at the bottom of your screen, especially questions related to what Betsy was talking about toward the end there, some of the experiences of mental health, anxiety, depression, loneliness that seniors may have experienced because of the pandemic, but also these lessons of resilience. When we thought about the design of this program, we wanted to use this as an opportunity to look back, but also to think going forward, what are the lessons that all of us can learn? And a part of that was for us to bring in some people from the community who had spent time with older adults over the last couple of months. So we're very fortunate to have three distinct individuals who've done some really great work in the last year or so. Two of them are students, PhD students at the University of Colorado, Colorado Springs, and one is a member of the healthcare community here at CNA. Let me introduce the three of them, and then I'm going to have each of them talk briefly about their experiences. Our first is Marissa Pfeiffer. Marissa is a fourth-year doctoral student in clinical psychology at UCCS in the Aging and Mental Health Lab. Her research focus is on mental health issues in later life, specifically anxiety, self-esteem, and ageism among older adults. Marissa grew up in West Virginia, which, as all of us in Colorado know, is almost heaven, if you listen to John Denver. She grew up in West Virginia, received her bachelor's degree in psychology at West Virginia University, and completed a master's degree at UCCS. She's currently providing psychotherapy and cognitive assessment services to older adults in the Colorado Springs community as part of her practicum rotations at both Silver Key Senior Services and Rocky Mountain PACE. We'll hear first from Marissa. Following her, we will then be introduced to Stacy Yoon. Stacy, go ahead and wave if you're on the screen there as well. Stacy is also a fourth-year clinical psychology doctoral student at UCCS in the geropsychology track. She is in the Aging Families Lab working with the principal investigator, Dr. Sarah Qualls. Prior to attending UCCS, she received her BA in psychology from Washington University in St. Louis. Her research interests include aging and mental health disparities, minority aging, and end-of-life issues. Clinically, she is currently completing her final practicum training before the internship at Rocky Mountain Healthcare Services Program for All-Inclusive Care for the Elderly, another program presented by PACE. And our final participant in this segment will be Holly Hepner. Holly, go ahead and wave on the screen there. Holly is a CNA here locally, a certified nursing assistant who's working at Sunrise Senior Living for the past 5 years. Holly specializes in care for patients with Alzheimer's, dementia, and various other memory challenges. She cares for her patients by bringing a personalized touch to each person and treating them with compassion and dignity. Her kindness and skillful caregiving have made an impact on each life she has been a part of. Holly is more than halfway through her training to become an RN and looks forward to working with patients as a hospice nurse in the future. So with that, I'm going to hand over the screen and the microphone to Marissa.
Thank you, Will, for those introductions. So today I will be touching on the impact of grief and loss for older adults within the COVID-19 pandemic. First, I want to mention that grief and loss are already a significant part of older adulthood. As people move into the later stages of their lives, they will experience losses, including the loss of their jobs due to retirement, disability, or ageism. They may experience physical health declines that cause mobility and cognitive decline or sensory impairment. And they also may experience greater loss of loved ones as they age. While COVID-19 has caused losses for all of us, it has done so at a greater extent for older adults. Many older adults have lost several significant others, including spouses, parents, siblings, colleagues, close friends, neighbors. This is likely more so for older adult individuals because they likely have more aging significant others than younger cohorts or younger generations. Older adults may also feel greater anxiety about contracting COVID-19 compared to other age groups due to the increased vulnerability that they have to adverse outcomes, coupled with those losses of people that they love in their lives as a result of COVID-19. As Betsy mentioned, older adults are disproportionately likely to experience adverse effects as a result of COVID-19, such as greater likelihood of cardiovascular complications and mobility issues. So even if they have gotten COVID-19 and survived, they may have significant lasting consequences that impacts their ability to recover fully and return to their pre-COVID functioning levels. Additionally, COVID-19 has impacted many older adults' ability to engage in things that give their life meaning and purpose. So quarantine and social distancing mandates have limited the ability for many older adults to spend time with friends and family, and they've become increasingly socially isolated. And as Stacy will discuss shortly, they may be experiencing increased ageism and bias as well. The activities and hobbies that older adults previously enjoyed may have been suspended or went remote. And for older adults who have limited experience and knowledge with technology, they were often unable to engage in activities that had been adapted for the COVID-19 world the way a lot of younger cohorts were able to do. And while everyone experiences significant losses and grief experiences in their own way, grief is a normal response to loss, and it is associated with multiple types of losses, not just the death of loved ones, as we often think. So we often think of grief as profound sadness or despair. And while it is common that grief can present that way, it can also be characterized by things like anger, rage, confusion, denial, extreme guilt, feelings of numbness, and loss of purpose. Grief can also cause increased anxiety about one's own mortality. So grief can show up in a lot of different ways rather than just sadness. And those are some of the ways that you might be able to identify maybe this person is experiencing grief. Grief often is painful and difficult to watch from the outside. And I want to emphasize that even though it is difficult, it is a normal reaction to loss. So grief often resolves over time, and it becomes easier to deal with and less overwhelming with increased distance from the loss and by seeking out and finding new sources of purpose after a major loss. And although grief and loss are difficult and painful processes, it is important to note, like Betsy was mentioning, that older adults are highly resilient. Because loss and grief are a normal part of the aging process, many older adults have experience that they can draw on to help them cope with the losses associated with COVID-19. Despite the losses of older adulthood, older adults generally report greater mental health than younger and midlife adults, and they also have lower rates of most mental health disorders. Meaning making surrounding a loss and identifying new sources of purpose following a loss is one of the most important ways to resolve feelings of grief. And given the exacerbation of losses due to COVID-19, this is an important way that mental health professionals can help older adults process their grief, especially when grief is experienced for prolonged periods of time and disrupts a person's ability to function in their daily lives. So with that, I'm going to turn the microphone over to Stacy Yoon.
Okay, thank you, Marissa. So I'm going to talk briefly about how ageism and COVID are related. And as Betsy mentioned, older adults have been hit hard by COVID-19. However, it is important for us to understand the relationship between ageism and COVID and how we may have utilized ageism to undervalue the lives of older people during this time. Ageism is discrimination based on negative stereotypes about age. Over the course of the pandemic, we have seen considerable media coverage about the risks of COVID-19 to older people. Unfortunately, much of this discourse has negatively fueled an existing ageist sentiment around us. Negative attitude towards older adults pose significant risks to health and well-being of older adults, such as higher mortality risk, poor functional health, slower recovery from illness, and poor mental health. Even though people 65 and older are at a greater risk for hospitalizations and death from COVID-19, people of all ages are profoundly affected by the pandemic. Not only that, older adults are diverse in their experiences of COVID. Among those who are over 65, age spans over 4 decades, from 65 to 100 plus. And the risks related to COVID and the pandemic differ across this age group. Moreover, the likelihood of contracting and dying from COVID-19 has fluctuated dramatically over the past year, with notable geographic differences across time points during the pandemic. Furthermore, older adults also vary in their geographic differences in health status, with some older adults retaining high physical and cognitive functioning into their late life, and others experiencing multiple chronic diseases and functional disabilities. Therefore, we should not assume that age is the primary and only risk factor for COVID based on strong sentiments of ageism. In fact, research suggests that other factors such as male gender, being a racial or ethnic minority, and being a healthcare professional increases the risk of COVID-19 across all age groups. The assumption that all older adults need support and protection during the COVID-19 pandemic is also an oversimplification. Some older adults have been in the front line fighting for the pandemic as well, alongside with younger adults. Likewise, many older adults are caregivers for family members who are frail, disabled, or cognitively impaired. While it is true that many older adults are disproportionately affected by social distancing policies and other restrictions to stop the spread of the virus, resulting in increased loneliness, social isolation, loss of freedom, and support networks, we should remember that people of all ages have been impacted socially and emotionally. Many people also use ageism to suggest that isolation is particularly difficult for older adults because they cannot use technology to communicate with family members and friends. However, as Bessie mentioned, research revealed that many, although not all, older adults use the internet and digital services for maintaining social relationships and remain protected with access to medical care. In fact, all adults who are from lower socioeconomic class and reside in rural areas experience difficulties with access to technology regardless of their age. One of the disturbing social consequences of COVID include a significant increase in the number of elder abuse cases, paralleling with the rise of ageism. Social isolation is a significant risk for elder abuse. Other risk factors include things like cognitive impairment, physical frailty, and dependence on others for care. Nursing home residents are also particularly at a higher risk for elder abuse. All of these risk factors have been compounded by COVID-19. Elder abuse and ageism are extremely hard problems to combat. And although there's no panacea to reduce ageism and change attitudes towards aging in all people, combined interventions with education and intergenerational context seem to show the largest effects on attitudes. Social connections between generations are vital. There is so much that we can learn from each other if only we can reach out and make an effort. In addition, we must remember how much older adults still have to contribute to the society instead of only seeing the dynamics of support and dependency. So the best solutions is to encourage social participation in older adults, connectedness, and foster a sense of belonging for them during this pandemic, which is a particularly difficult time for them. So now I'm just going to turn the mic to Holly, who's just going to talk briefly about her experiences clinically.
Hi, I've worked at a Sunrise Senior Living for about 5 years, and we try to maintain a home-like environment, freedom of choice. It's their home. I decided I'm going to stick with focus on what it's really just been like for them for the past year or more. That day came when the health department told us everything had to change. They had to stay in their rooms, wear masks, limited contact, no more family visits. And we were just like, oh God, how are we going to do this? And we tried our best. For a while, they had window visits that were allowed. Those had to go away too. Then video chats, working in memory care, they don't really understand window visits or even video chats, which has left them feeling just abandoned and isolated from their families. They've become so dependent on us. They view us as more their family, which is heartbreaking for them. They don't really know how to do that. They want to touch their people, hold them, and they can't. And we're wearing masks and gloves and gowns. And what was going through their minds when they communicated, it was just awful for them. We did our best to keep it as good as we can, but they had to socially isolate from each other even. Trying to keep memory care residents in their room is not an easy task. And they suffered for it. They just wanted to visit their neighbors because that's their home. The bonds diminished with families, even when now we're seeing the effects of that when families come back. They don't really have the same bond with them as they did. And we're trying to rebuild that, but it's not an easy thing after 15 months of this. They didn't get to have holiday celebrations like they usually did. We have hospice service come in. They weren't allowed to come into the care anymore, so we took over all of that, including medication, end-of-life care. Only at imminent death was anyone allowed in, whether family or hospice. That completely changed the days for the residents because they were used to a routine, and we took that routine away from them because we had to for their safety. More depression, loss of appetite. We didn't actually have anyone die of COVID in my unit, but other health issues they had seemed to accelerate. It's the depression and loneliness, feeling no one cared. They've been vaccinated. They've had to test once, twice a week like we did. And, even now, even though most of us are vaccinated and most of us are still testing, the residents still get tested because we just don't want them to suffer that. And trying to explain to them what this pandemic is, they don't really understand it. They just know that we're keeping them from doing the things they want. They don't get to go to the outings to restaurants or anything. And it's just been really hard to see for them. And the families have suffered immensely for it because they're trying their best just to get through having their family being unable to care for them themselves, whereas they could be at our facility 24 hours a day. It's just been really bad all around for the residents and their families. Staff, we get through it because that's what we do, but it's hard to watch. It goes home with us sometimes. We are grateful, though, that now we're returning more back to normal. It's getting there little by little. Hopefully we keep on that path because our people sure need it. And I am so grateful for the community who reached out to at least send Christmas cards, gifts, phone calls. I'm looking forward to see what else we can bring to it. It hasn't been easy, but these people, they have definitely been resilient, as the other two speakers said. Most of them have bounced back way beyond what we thought. All right, I will pass it back to Will.
Well, thank you to our most recent three panelists. Holly, I wanted to mention that somebody in the chat feature said, Holly, I love your passion for work, sister. I feel your heart.
Oh,
And I think any of us who had a family member that were in a facility over the last year or so are so thankful for people like you who were family. You were family and you brought humanity and compassion into that setting. So thank you for that. And also, I'm just struck by the fact that we had two PhD students who were a lot younger than the older adults we're talking about. And I just love that there's this new generation that sees the beauty of this intergenerational work and that you're specializing in that for your studies and making a career of it. So Marissa and Stacy, thank you very much. A reminder to our virtual audience, if you'd like to ask a question or post a comment, please do that in the Q&A feature. One thing I did want to mention, we did have a hospital chaplain on board with us during the first portion of this event, Roger, who is a chaplain at Penrose Hospital, Penrose and St. Francis. He mentioned there's an article in the New York Times that he referenced. He sent us a link that's about a doctor who got COVID and how that changed the doctor's perspective on his career and on the experience of having COVID. And then he said, oh, I got to get back to work now. I'm a chaplain, so I got to go do my job. We will put some resources like that in a follow-up email to all of you. So if anybody else has referrals like that, please refer that. So I'm going to ask a couple of questions while we're waiting for our audience to chime in as well. Betsy, I want to go back to you. You focused our attention early on the issues of anxiety and depression. And I'm just wondering if you could give us some tips on how do you identify those who need professional help? What are the signs? What are the ways for those of us who are novices to identify that?
I thank you for that, Will. Yeah, I think it's a little different in older adults than we might be used to, particularly in older adults who have lived through the Depression and through, many, many difficult things in their lives. This is a generation, by and large, that's a little more stoic than younger adults. And so you might not see in an older adult depression presenting as overt sadness, crying a lot, describing the fact that they feel very down. It might look more like withdrawal. And so it might just be a lack of interest in things that previously gave them joy, just not really interested in talking to the grandchildren on Zoom or, looking at, connecting with their friends now that things are opening up a little bit. So that is definitely a warning sign. And then the physical signs of depression might be things like a loss of appetite, just they're not really eating very much. Their sleep might be very disrupted. You might see that they are even considering what mobility issues they might have. They might just look like everything is slower, their speech, their movement, beyond what you would expect from physical reasons. And then finally, they might just be speaking a lot about death, and not unusual, and not to be discouraged in older adults or younger adults. I think all of us need to think more and speak more about death and what we want that to look like for ourselves. But I think when it becomes kind of a ruminative topic for an older adult, that's something to really be aware of and find out if that's just normal for this chapter in life, or maybe it's a signal that they might need some professional help, perhaps contacting their doctor or a psychologist, a social worker, someone that could reach out to them. Anxiety is a little easier to spot. Definitely a feeling of always be on edge, being really worried about things, just much more worried and ruminative, and having trouble sleeping. Irritability is a big one for that. And so, again, this is treatable. These are treatable illnesses, and someone should not be denied treatment and therapy, because they're of an older age. These are not just normal parts of aging. And so if you're seeing this in loved ones or people that you're working with, it's really important to get some help. Thank you, Will.
Great. Well, Betsy, thank you for helping us with some tips on that. We also had a member of our audience chime in. Peg, thanks for your tip. Sometimes Peg said depression can look like cluttering or lack of self-care. So if you see that in somebody that perhaps that's another sign.
Any remarkable change in behavior, that's the wonderful point. Thank you, Peg.
And then Kathy mentioned, just thank you for shining a light on the grief that emerges for all of us. We don't always know how to name that angst. Amen, sister. We just don't spend a lot of time learning that language, do we? Speaking of grief, Marissa, you mentioned that as something that you kind of are intrigued by. Again, since that's been your practicum and internship experience and some of your research, for the rest of us, what are some ways that we can help others cope with grief, help older adults in our lives cope with grief?
Thanks for that question. Yeah, so oftentimes I think we don't know how exactly to help people through grief because it feels really overwhelming and scary. And so we may gravitate towards just trying to distract them. And sometimes that can be helpful. But I think also allowing the person to talk about their grief, and especially if it's the loss of a loved one, giving them the space to talk about happy stories, to reminisce a little bit, and to talk about missing the person. Just focusing on distracting and getting their attention away from their grief can sometimes minimize it and also send the message that they're not allowed to talk about it or that they shouldn't talk about it. And so if you have someone in your life who has lost someone that was really important to them, or lost something that was really important to them, a lot of what I've seen during the pandemic has been loss of community, especially around churches when churches were shut down for a long time. So allowing people to just talk about it and being an ear for what they miss, what they loved about it, can be really helpful. And then also giving them that extra source of connectedness. I think it might have been Stacy and Holly as well, talked about how important the connection is for older adults and really for anyone during the COVID-19 pandemic. And so if you can provide somebody with a friendship or being a social connection for them, that can be really helpful when they're experiencing grief as well.
Great, thank you, Marissa. Holly, I wanted to pull you in on this as well. I think all of us are struck by how normal end of life issues are for you. You feel like you navigate that with comfort and ease that for most of us is not an easy thing. And I was just wondering, talk to us a little bit about that and what tips you might give us for how do you deal with those really, really hard final days, end of life days for a patient?
It's crazy. I recently dealt with the loss in my own personal life as well. And thank goodness I had the experience I have. When my residents are getting close, our biggest thing is they don't want to be alone. They are so afraid to be alone because they've lost so much already. Their whole life went from their house to this small room. And, they've lost so many friends due to age and everything. Our goal is to keep them comfortable, but also get them where they're going and give them the dignity and respect they deserve and hold their hand, whatever they need to get through it. I mean, the families, they are a huge part of that process. They come in and they're not sure how to go with it. And we learn it because every person is so unique. But, with working with the families and everything, we do our best to get everyone through it the best we can and make sure they have the closures and the comforts they need and that they get to do it on their timeline. Because that's the biggest thing is they have to have all their closures and pick when they're going to do this because they need to make sure all their people are okay. And, we see it a lot doing the hospice care and it's not easy, but I can't imagine not doing it because some of them actually I have seen go alone because they don't have family or friends. And, thank goodness for the volunteers that we do have come in to help us out with it. I think the biggest thing is just having people there. If we can have the families there, that's the best. But if not, then we make do with what we can and make it as good as we can.
Right. Thank you, Holly. We had another member of the virtual audience chime in and say, when working with older people, it may be helpful to ask them what experiences they've had over the years to help them cope with loss and disappointment. It may also help them get in touch again with their sense of humor. One of the things, Stacy, you mentioned was that we just make assumptions about older adults that are this ageism that's creeping in. And I love it that Perry mentioned they have a sense of humor. They maybe just haven't been invited to share that with anyone in a long time. What resources might you offer to us that would help us to kind of learn about how to be in touch with those assumptions we make and how to approach ageism with a more proactive, I'm going to take this on and change the world kind of attitude? How have you done that? What resources can you can you give for us?
So there's different organizations that offer different resources. So WHO has a pretty big global ageism task force, and they have different resources on ageism that you can access. American Psychological Association also has a team of experts that are working on this combating ageism. That has a really nice resource list for different populations. So if you are older adults who are struggling with ageism, some resources for that. If you're an educator or a supervisor or leadership position that are wanting to tackle kind of workforce ageism, they have resources on that as well. But like I mentioned, I think the key thing is really that exposure piece, getting the intergenerational exposed to different generations of older adults and younger adults. That has been shown to be kind of the best tactic we have to combat ageism at this point.
Great, thank you. Starting to get some questions now. I'll just mention a question that we will hand to our next two presenters who start here in a couple of minutes. And that's now that residents are beginning to re-engage with activities and living, what changes do you see happening? And I'll leave that for our next two participants. But I do want to go back to Betsy. Somebody asked a question of, again, with depression, how do you know when it's best to treat depression with drugs and when maybe something as simple as social interaction is actually the best antidepressant?
Okay, so that's a really good question because it's a very tricky question. A lot of older adults are on multiple medications. And so it's obviously you'd like to not add one more if it's not really necessary. There is a place for antidepressants in older adults, but we know from research that they tend to respond less robustly to antidepressant medications than younger age groups. So the best place to start is with social interaction, with obviously different kinds of connection to their past, connection to activities they love, and then psychotherapy. Psychotherapy is very helpful in this group and has been found to be as effective as antidepressants for all but the very, very clinically depressed. And it provides the connection that often they need. And so first, connection with just anyone who's available to do that and connection with things they love, but then next kind of referral to a psychologist or another psychotherapist, social worker, someone like that.
Great, thanks for that help. Holly, I want to come back to you. We had one of our audience members, Paulette and David Greenberg, the founders of the Greenberg Center, ask a question about what are the assisted living facilities doing to really that are making the biggest difference to give older adults sense of purpose and encouragement. You seem to allude to some of those, but give us, we need a few more examples. Give us some of those encouragement examples.
In my facility, we have a Live with Purpose program where it focuses on what do they love best. If there's music or art, purpose, where they actually do projects for the community. We've had to do them differently, but we've still kept doing them. But now we're able to get more groups together. So hopefully we'll get the volunteers in soon to help with it. But we've kept them engaged with different programs for whatever makes them feel better, what makes them want to be proud of themselves, make them feel that they are still as amazing as they really are. So, we just come up with anything possible. If they don't like to engage in anything, we will find something. We have life enrichment managers who do one-on-one specifically for those who don't want to do group activities. It's all about building up their self-esteem, making them know that they are still valuable. They still can do great things. We just got to sometimes dig and find out what their purpose is. What do they want to do? What do they want to accomplish? I mean, they still have goals, even memory care. They still have things they want to do. So we do what we can to make it happen.
Great. Thanks, Holly. It's so nice to, I think I want to live at Sunrise Senior Living when I get to that point in life. I want you to be my CNA too. We're going to shift now we have about a half hour to go in our program. And when we were designing the sort of overview of what we wanted to do here, The final piece we wanted to offer to the attendees was a sense of how can you engage in the community? What's going on here in Colorado Springs and how can you be involved? So we reached out to two very important organizations in our community, and we're going to hear from representatives from each of those organizations now. The first person we're going to hear from is Melissa Martz. Melissa is the Program Development Administrator for the Area Agency on Aging at the Pikes Peak Area Council of Governments. And I think she gets extra pay just to be able to say all of that in one breath. Melissa has been an active community leader for many years in the Colorado Springs community. She was the Chief Programs Officer at Care and Share Food Bank, the Executive Director of Women's Resource Agency. And I know from just watching her in the community that in her current position, she is a tireless and outspoken advocate for older adults in the Colorado Springs area. Melissa completed a master's degree in education from UCCS. We have a strong UCCS connection here today. Worked at Ranch Foods Direct, I love Calicrate beef, and owned the Tejon Street Market, which is a fun connection that I didn't know about. So we'll hear from Melissa in just a minute. After Melissa, we're going to hear from Sean Dana. Sean serves as the Senior Manager of Business and Donor Relations for Silver Key Senior Services. Silver Key has been in the community for over 50 years. In this role, he creates and implements strategies to expand and enhance services in legacy planning by inviting new and existing customers, donors, and community partners to invest their time, influence, and resources. Sean holds a Bachelor of Arts degree in social work and a Bachelor of Science degree in counseling. Prior to Silver Key, he worked for 14 years at Compassion International and spent over 7 years in social work as a case manager for seniors. It was that amazing season of life that produced a deep respect he has for the value, significance, and resiliency of the older adult population and continues to fuel him in his role with Silver Key today. So with that, I'm going to hand it over to Melissa and Sean. And what I'd like to encourage our audience to do during this period of time, they're going to be giving you very practical ways that you might volunteer in the community. If it triggers an idea of something you've done during COVID, ways that you've connected with your family or people in the neighborhood or volunteered in the community, put those in the chat feature. We want to all benefit from your great ideas. So while they're chatting, put those in the chat function. So Melissa, take it away.
Thank you, Will. And while the PowerPoint is coming up, I just want to, again, give kudos to the Greenberg Center for the really in-depth, thoughtful efforts that you undertook to bring together the panel of all of us speaking tonight. I appreciate the diversity of all of us who are here and am grateful that I'm a part of the conversation to share a little bit about an organization that does a lot in our community, but it's really a lot of behind the scenes work that maybe people have not really heard of us before. And so the Pikes Peak Area Agency on Aging is under the Council of Governments here in the region. And so we serve a 3-county area, El Paso, Park, and Teller counties. And our organization receives the Older American Act funding that was passed right around the same time that Social Security was passed, when our United States of America realized that, we're going to do Social Security, but we have a lot of people who are going to be aging, and we really want to give resources to folks as they are, getting older, so that, hopefully they won't, need to access medical care as often or other resources. And so the Older American Act has been around for a long time, and we bring in about $6 million into our community every year and our region. And what we do is actually share that funding with other organizations in the region. And so we provide funding to the UCCS Aging Center. We provide funding to Silver Key. That being said, both organizations do not rely on our money as a sole support. They are constantly working to bring in more money to provide the really good services that they do. But, you know, we basically contract out that $6 million to about 21 different organizations. We make sure that there's audiology services provided, there's transportation, there's family caregiver support, just a multitude of services that, again, people might not even know older adults can have access to. And these services are all provided at no charge. So if you are 60 and over and you have a need, you can call our organization and tell us what is going on, and we're there to get you connected to the right services and supports. And then during COVID, you know, why this is so important is during COVID, our organization received an additional $2 million to give out to these organizations to make sure that older adults got the things that they needed during COVID. We had no idea what those things were going to be when it started. I'm going to share a little bit more about that in a few minutes. But it was amazing to have that additional funding come through. And when it came through, that money wasn't siloed. One of the biggest problems with the Older Americans Act is that the money is really controlled and, you know, has barriers around it. And so the majority of the money that we get is for, you know, hunger relief and feeding programs. And, you know, we have people that need other types of services. And so when the COVID money came down, basically those restrictions were lifted. And so we were able to shift and pivot and do so many things for older adults that made all the difference. And we did that with Silver Key. We did that with the UCCS Aging Center. We did it with the Fountain Valley Senior Center, all kinds of organizations. We were pivoting and getting services out to people that needed them. So next slide. And when COVID hit, the things that we saw, you know, really were already, you know, we've talked a lot about all of this already, but I too wanted to focus and talk just a brief moment on ageism, because really, you know, that was something that folks really started to see in the media, the messaging that, you know, older adults are a burden to society, you know, these older adults that are living in, you know, assisted living, we're just going to let them, you know, suffer. It was terrible. And it really was an opportunity for all of us to have our eyes opened about the messages that we hear daily in the media. And so our organization really got out there and sent press releases on a regular basis. We had many opportunities that we got to be interviewed and talk about the benefits of our older adults in our community, how we're supporting them, how many of them are actually taking action in the community and fighting COVID on the front lines as well. So, you know, this whole ageism piece really came, you know, was really a real problem during COVID. And I'm glad that we had an opportunity to dig in and address it. Another issue that came up were the communities of color as well, and the lack of services and the missed messages also that were coming out through the media. And so there's an organization called the Hastings Center, which actually did quite a bit of research around messaging around communities of color and vaccine hesitancy and vaccine awareness. And what they really found was that communities of color were not afraid to get the vaccine. They actually wanted it. And one of the bigger issues was figuring out how to get the vaccine and where that might happen. And so that was really, you know, an interesting message that also needed to be communicated out through the media and, you know, let people know that there is another story going on out there around communities of color. Next slide, please. And so some of the things that really, you know, kind of came up, and fortunately with the less restrictive funding that came through, we were able to do some really important services. And without these, I think older adults, the volunteers, the people who work with older adults, I think the landscape would have looked different. And so it's really great that we had flexibility to distribute out $2 million and allow organizations to do what they needed to do. Right when COVID hit, I was, because I do program development, I was on webinar after webinar and meeting after meeting early on with our state governor's office and also with the national office for aging. And we were talking on a regular minute by minute basis. When is Governor Polis going to say that we are a major disaster? And when was he going to make that declaration? Because once he did that, that was when the money could come through and we had the flexibility to do what we could do. And calls of reassurance, getting food out to people in very unique and different ways. Again, technology played a part, and so many more things that we did. The calls of reassurance, though, were probably one of the most impactful pieces. People volunteered to make these calls to individuals, and they did them across all of the different organizations that serve people in the 3-county region. And what that looked like was, you know, just picking up the phone and calling somebody and checking in with them and asking them how they were doing. And that really made a big difference. Next screen. And another fun resource that happened was a partnership with Humana and our organization and Innovations in Aging, and an organization that does behavioral health intervention called Pearls. We all came together and did what were called busy boxes and busy bags. We did 1,300 of these, and they were delivered to all of the low-income senior housing apartment complexes in the city. And this was done, I think we had finished delivering those busy bags by the beginning of April. So we rallied and got those out and made those deliveries, made those connections, you know, shared information with older adults in those apartment complexes so they knew who they could call and talk to. And this gentleman is Irv, and he is 88 years old. And he met me with his dolly, and he was going to be delivering those busy boxes to all the residents in his apartment complex. And so he was a vibrant, active senior. He was ready to go. And he doesn't have a mask on at this moment, but he had one on before I took the picture. So we wanted to see his smiley face. So he was a sure highlight, and he was thrilled to be a part of the solution. Next slide. And so as we kind of move forward, the good news is that there's going to continue to be funding that's going to come available to the organizations that provide services for older adults. And this funding will continue to have, you know, open-ended requirements on it. So we can continue to have the flexibility to do things as we move forward for the next 3 years. This is not stopping now, it's continuing. And so we're happy to continue to get the American Recovery Plan Act funding, be working with the state on the Build Back Stronger initiatives that are happening, and continuing to work with all the 21 organizations that we help with funding in our 3-county region, and make sure that you know, services are still provided. We have a huge rural divide, and so looking at how to solve and work through those rural divide issues, and continuing to focus on community of color outreach and equity, as well as elder justice. Those are pieces that are all going to continue to be a focus as we move forward. And in terms of people that want to get engaged and do things, one of the opportunities that came up during COVID is called curbside culture, something that was put together by a lot of the artists in the community. And it's an opportunity for different artists to, you know, come into your neighborhood. What we did was we actually brought them to some of the assisted livings in the community and had artists do what they do best. I loved the comment about the improv, you know, doing some improv work as curbside culture. we had many musicians. That was kind of the main interest when we asked older adults what they wanted. It was musicians, but I love the improv thing. And I love taking it even one step further to thinking about how some of our best improv people can actually teach that skill to older adults and actually have them doing some improv. And I'm going to be taking that back to the Curbside Culture folks to be sharing that. And if people want opportunities to volunteer, I know Silver Key is going to share some things specifically, but again, our organization supports over 21 different entities in our community, and all of those are looking for volunteer outreach and people who want to do volunteering. So I will just throw it out there that people can contact me if they want to get more engaged or do some type of volunteering. Feel free to reach out to me and I can hear what you're interested in and introduce you to the right organization to do more volunteering and to get your skills out there to support and make a difference. And with that, I think that brings me to introducing Sean over at Silver Key, who can share some of their specific things that they did during this time and what they're looking forward to.
Good evening, everyone. Yes, I am Sean Dana. I'm from Silver Key Senior Services. For those of you who may not know, Silver Key is a passionate champion for the health, safety, dignity, and independence of older adults in the Pikes Peak region. We have just a small history, actually 50 years now, here in the community, serving seniors with great delight. In fact, it's our great delight to serve more than 10,000 seniors per year by providing transportation, nutrition services, and health and wellness as well for seniors. As for most of us, the COVID-19 virus presented both challenges and opportunities. That is certainly absolutely true for Silver Key. We realized very quickly that we needed to take a page from our senior friends who are so have such ability to adapt and to be resilient. And so we decided to take our example from them and to do the very same thing so that we could become an essential service, so we can continue to provide the services that are so desperately needed by the seniors in our community. But that meant we had to pretty much change every single service area. In our transportation area, of course, we no longer could have as many seniors riding the same vans to the same different appointments. So we had to scale back, which meant we had to increase our fleet and increase our volunteers. Most of our drivers are volunteers who deliver our seniors to their appointments. And so it was a wonderful opportunity, and the community stepped up in great numbers. Prior to COVID-19, we were seeing about 115 rides per day. In 2020, with COVID, we're now seeing about 225 trips per day for seniors in our community, thanks to those who volunteer their time to make sure that those seniors can get to those important appointments. We also believe that food is medicine, and so in our nutrition program, we had to adapt very quickly. Our congregate meal sites where seniors are able to get together to fellowship. Of course, that was not permitted at all during COVID, but we again were able to adapt to flourish and thrive and help make sure that seniors were able to receive the high quality meals that they're accustomed to. What used to make our meal delivery very unique is that our volunteers didn't just sort of pass the meal to them and then leave, but in COVID time, they had to be socially distant. And even though they wanted to have those connections, they could kind of wave at them or, but they would put them in an insulated bag and try their best to engage, but through the glass. But even with that, we were able to see over 600 meals per day delivered to our seniors throughout the community, again, primarily through volunteers who were on hand both to help prepare those meals and also to deliver them to our seniors. So that's around 145,000 meals served in 2020 alone, thanks to the help of those volunteers and so many others who joined us to provide the funding needed to do that. Of course, seniors have been hardest hit by the effects of COVID-19, as we've been talking about this evening. And And we have seen tremendous opportunities. Please, next slide, please. In addition to our transportation and nutrition programs, we also have a wonderful Silver Key pantry. The model for that is very much it really does promote the dignity of our seniors in that they're able to come to our food bank and to shop typically. But then during COVID, of course, that wasn't permitted, not a big enough footprint, and not enough seniors could get in. And so we were able to pivot and adapt and still serve over 2,000 clients per month. And many of those, around 300 of those, we actually delivered their commodities to them to make sure that they had those. One of the interesting things that we found when we were delivering those food bank meals is that many of the homes that we were delivering to of seniors were caring for teenagers who were their grandchildren. They were caring for their teenagers in their home. And they were having a very difficult time meeting the nutrition needs of themselves, but also of the adolescents who they were trying to care for. And so we were able to increase our delivery of those commodities to make sure that those families had the proper nutrition, because we believe that food is medicine. And so it's very, very important. Over 1 million pounds of food was able to be provided in 2020, thanks to those who responded by organizing necessity drives and donating items, and in our partnership with Care and Share, who provides a great number of the commodities that we're able to distribute in our community. Next slide, please. So what can you do to get involved and be part of making a difference in the lives of seniors? So one of the things, as we've been talking about tonight, with the social isolation effect, we were able to raise up a couple of brand new programs that have really had profound impact. One is targeted specifically on veterans, where 55 or older veterans are serving elder retired veterans with companionship care. And that has been an outstanding program. We can always use more volunteers for that program. If you're a retired military service person and you'd like to get involved in encouraging the other generation, the retired generation, we would love to have you join us as a volunteer in that program. We also were able to raise up the Reassurance Plus program, which also counts on volunteers to provide caring companionship and a hot, nutritious meal. So we've seen tremendous impact from both of those programs. And again, relying on volunteers who serve as companions for those seniors. So next slide, please. So if your heart has been touched and you have found that you'd like to get involved and do more, you'll see this wonderful picture on this slide here. This lady, Sue here, was having her first conversation with family members in over a year through technology, and her companion was able to assist her. She's part of the Reassurance Plus program and has given us permission to use her likeness in this presentation. And so we are delighted to be able to help seniors reconnect with their family members through that companionship program. So what would you, where would you like to get involved? So there's lots of different ways. You can plan, organize, and host a necessities drive that would help our food pantry. There's information at www.silverkey.org/necessities-drive. You'll get all the information you need about how to go about that, what items are needed. One of the things that is unique about our pantry model is that we provide pet food, hygiene supplies, as well as food to make sure that all of those different bases are covered. If you feel a tug on your heart, you'd like to get involved serving those seniors, we'd love to have you join us. We increased our volunteer base by 115 volunteers during COVID alone. So lots of people, lots of opportunity to remember how to give back and remember what it means to really build healthy community. And so many more are joining us. If you'd like to become a Silver Key volunteer, you can see the information here on the screen. One really important thing is just to take notice of seniors in your own neighborhood or maybe even in your own family. Make sure that they know about Silver Key information line, which is 719-884-2300. And then point them, please, to our website as well. That's www.silverkey.org. And those are ways that they can get more information on different services that could be available to them. Next slide, please. Don't want to forget as well, we have a wonderful Friends of Silver Key thrift store. It specializes in durable medical equipment, but has all the other important shopping details that you might want in a thrift store. Outstanding prices and very gently used merchandise. But the durable medical equipment is all sanitized prior to being reused. And it's a wonderful way to pick up those items that loved ones may need. And so our theme is donate, shop, and repeat. So keep on doing that. Come on out with us, and we'd love to have you join us. If you feel a generous spirit right now and you want to help us to promote even more of these services in our community, we welcome generous donations or one-time donations, or monthly contributions also are very, very welcome. And you can find out more about how to do that at, again, silverkey.org/ways to give. Please like us, follow us, and comment us on your social media platforms. That also helps us get the word out there about Silver Key services as well. Thank you so much for the opportunity.
Thank you, Melissa and Sean, for those ways to get involved in our community. It's so great to know that we have these two wonderful organizations that were doing so much work in the last year. And I hope that we'll get some folks from our audience to engage with you in the future here. I did want to, we're going to close up here. We're reaching the end of our time. I did want to acknowledge, Melissa already mentioned Peg's wonderful recommendation about a volunteer improv program. Peg, we will put you in touch with Melissa because it sounds like there might be some synergy there. And her observation was that it's hard not to experience laughter when you watch people do improv. And I know when I do improv, there's a lot of people laughing, and not because I'm funny, but because it's worth laughing at. So that sounded like a great idea. I'm going to issue some thank yous and bring Betsy in one last time just for some concluding comments. First of all, I really want to thank all of you in our virtual audience who are here tonight. We are just so grateful that you spent some time with us this evening. Remember, this event is recorded. It will be available on the Greenberg Center website tomorrow for free on demand. So refer your friends and family to that. Also want to thank my Greenberg Center colleagues. First of all, Paulette and David Greenberg, who 18 years ago had a vision for this amazing community organization. There have been so many great events over the year, and we're grateful for your vision. We are an all-volunteer board. We work hard to plan and host events like this. Well done, friends. If any of you would like to support the Greenberg Center or get on our email list, go to our website to do that. And finally, I'd like to thank all of our panelists tonight. For our PhD students, Marissa and Stacy, one of our audience members said, I love your passion, intellect, and gumption. And I am confident that if you can squeeze in gumption somehow into your dissertation, you will do very well on your dissertation. We also want to thank our community members, Holly, our CNA representative this evening, for your heart and your hard work. And Melissa and Sean, thank you for introducing us even more to the work that you're doing to the in the community. And we look forward to staying in touch with you along the way. And finally, Betsy, I just want to say thank you again for your original vision to create this event. When I attended the original version of this, it was all for healthcare providers. I'm not one of them, but I knew that it was interesting enough that I thought we could do something cool if we figured out how to adapt it to the community. So thank you for doing that. Any reflections you have on the event tonight?
Well, it's just been amazing. And I want to thank all the panelists as well. You know, there were some somber moments tonight, like when we were listening to Holly, but there was also so much uplifting information here about what these wonderful agencies are doing and what the students are doing to further their knowledge that they will take into their careers. So I do thank you all. And I do want to mention that, you know, we've all been through a very difficult year. The pandemic is increasingly under control, and seniors are getting vaccinated at higher rates than other age groups in the community. So, you know, we've probably been through the worst here, but I think we've had an opportunity to see what's coming. This increasingly growing population of older adults is going to have specific needs. And it was kind of, we hit it like a freight train. But now we can't let down that kind of momentum. We have to make sure that these needs are understood and met. And it certainly sounds like that's happening in Colorado Springs. I think mostly the message I'd like people to take forward is that these are some of the most valuable people in our communities. Anyone who's been on your volunteer squads could probably tell us poignant stories about the people they've met. And I think there's a lot to learn from the wisdom and resilience of the population that we were devoting tonight's efforts to, our older adults. Thank you so much.
Thanks, Betsy. So for all of you, tonight we were challenged and enriched by our panelists and our audience. You taught us not to be afraid to explore the grief and losses that all of us experienced over these past 15 months. You encouraged us to extend grace and kindness to ourselves and others as we heal from the experience of this horrible pandemic. And you introduced us to some ways that older adults have taught us all lessons of courage and resiliency. We offer our deepest appreciation to each of you for this inspiring perspective. Thanks again to all of you for joining us tonight. Invite others to go to our website to view the recorded version of this event. I'll ask all the panelists to wave goodbye to our audience here, and we'll wish you all a good night. Thanks for being with us.